Welcome to the next session of Food, Medicine and Life channel. I am extremely happy to have Dr. Praveen Saxena with us today. Welcome, Dr. Praveen.
Well, thanks, Dr. Priti, for inviting me. It's a
Thank
privilege
you.
coming here.
Thank you, Dr. Praveen. So, Dr. Praveen is a radiologist by degree, and he will share with us how he came into functional medicine and the great work he's doing today, especially with the autistic children. Dr. Praveen has a clinic in Hyderabad, and in fact, not one, he has three clinics now. And he helps people with autism, with cancer, with autoimmune disorders. And just now, he was sharing with me how he uses EMF and other technologies to shift the energy within the body and heal the patients. So let's hear from Dr. Praveen. Welcome, Dr. Praveen. And Dr. Praveen, I would really want to start with knowing, after doing radiology, which is number one in medicine, anybody who can get a radiology seat is always jumping because that's the best department you can go into. How come after a few years of practicing radiology, you came into functional medicine?
Again, I can tell you it is only about radiology because I used to do a lot of interventions in radiology. Interventions were usually like ultrasound guided interventions. I used to treat some people like with amoebic liver abscess and the people who having something like pleural effusions and trying to do some biopsy or fine needle aspiration. And we thought, let us not keep this patient for 3 days in a hospital. Instead of that, we'll ask them to come on a elective day, and within 2 to 3 hours, we ask them to go out and go to the home. So this is the concept we thought, okay, that is going to save much time and money for the patient. And somehow I was always on the this one trying to do some kind of things, and I started doing some ultrasound guided interventions. The first case I did was a ablation of a hepatoma, and I can tell you that hepatoma was less than 3 centimeter, and it was a unifocal one into this one. It was way back 15 years back. So those people, they told me, ki, okay, there is something like I was always I was used to get connect with the people, and they used to tell we can we do this particular one. Doctor family had a hepatoma, and he said, okay, can we try something because that patient was given some days or weeks to live. Then we said, okay, alpha fetoprotein was more than 5,000 or 8,000, something like that. And then I wore the hat of a interventional radiology with a see, we try to use a very thin 21 23 size needle, and we used to take that and it was so easy. I started doing percutaneous ethanol ablation for this particular patient, and the results were too good. And every month I used to do that for. We went for at least 8 to 12 months. We did it, and it was during the second month itself, we were able to see the decrease in AFPs and all, and it gave me a lot of encouragement. And that's how I entered into integrative oncology, number one. And yes, I had some personal challenge in the sense in the year 2000, I was told my son was having a disease called autism, and they were not very clear. They said it is something like pervasive developmental disorder or something like that. But between the lines, they were clear. They were not clear. They said, okay, you need evaluation. There's no treatment for autism and all. So I said, okay, let me look into what is it. And I started because one thing I was very keen was autism as a thing, whatever I'm dealing with. That this was not congenital. It came after 1 year because I knew my child, and he had a regression after 12 months, 12 to 15 months, something went off, and we lost in the sense the spark was lost. He was into social isolation. You call him number of times, he never used to. It was a challenge for me as a radiologist, and I always have a inclination. Yes, you are right. Actually, all the top rankers and all that. I was one of the but for me, the challenge was always. what is the cause? I had done so many pyrexia of unknown case origin cases, and we used to pick up something renal abscess or liver abscess or some smallest thing, and these people used to come to us after finishing off everything. They used to be on bombarded with all things, and we used to pick up that small abscess, and we used to drain that. And the kind of I was always used to look at, if there is a fever, there has to be some focus somewhere. And so I thought, this autism, what is the kind of what is the kind of intrinsic problem he has got? Because he has not just, we were very responsible parents. Most of the autism was told, yes, it is a non-responsive parents, refrigerated mothers. You are so, but I could see there was nothing of that sort. So I started looking at, trying to look at answers, and that was my always. I used to look at answers for. Um, provide how I can provide simple solutions for complex problems was my always. I was on the lookout for that. So started interacting with people around. There was something called Autism Research Institute was there at the time, and we connected with them. And I had to. They were very good doctors, and they were very good human beings, and they were ready to extend the support and the help actually, because I had to literally depend on sitting here, and on the other side they were so we started working on some area. I felt this is something like some iatrogenic problem, and and I tried working on some areas, trying to take up challenges. My family is of doctors, and they said, what is this you are doing? No, no, this is, you cannot take for giving that steroid also for some time for my son. They started questioning, why do you want to experiment with this? So I said, okay, let me experiment, because once the other people have given up, they said nothing can be done for this kid. So the egos are quite high, Dr. Priti. And but I can always tell you, it taught me to how to become a good human being first. Autism taught me a lot of stuffs. Autism helped me trying to look beyond what is the realms of what is of a doctor as well as a parent. So I could see a lot of stories like that from other corners. Then we started, okay, let me do some one by one. So this is all how I started this integrative medicine, and I believe we need that combined effort rather than just only focusing on one particular thing. Because I was not a big fan of uh, behavioral therapy, speech therapy, and all that, because uh, I I was always looking for answers, and it was not my cup of tea to wait for 2 years or 4 years down the line to see it improvements and all. So I had a little fight with a lot of mainstream doctors also, and they said, okay, I was like, I was told to take something like anti-inflammatory medication, and I said, no, no, why should I take this? This doesn't have anything. The narrative came was, no, no, he may get autism fits sometime later, so need to start now itself. So I said, okay, but till how long I need to take? And they said lifelong. So I said, no, this is not the answer. You have to. It's just trying to push the tip of the iceberg and make it immersive. It's not the answer actually. And so it was a long journey, Dr. Pulke.
Dr. Praveen, I have heard this story before, but today when you were sharing, I could sense a lot of emotions as if you were back in 2000 and that whole turmoil, which a lot of us are facing these days. You know, whenever any such diagnosis comes in our family, among our family members or loved ones, and when we allopathic doctors go to allopathy doctors, and the answer is take this lifelong, nothing else you can do about it.
Yeah.
You know, you can cry, you can feel sorry, but if you are innovative, if you are good, if your mind is really working, your mind questions, why has it happened and what can I do to correct it? Right? And I
Thing
definitely
is,
see.
the thing is, you need to look back and look at what might have gone wrong. And so I was confident, number one. Yes, there has to be some cause and effect relation always is there. So like that, we started picking up some threads and trying to look at, it's like it's like an entangled mesh. So you had to remove one by one things, and then you are there. I am very happy. My son is going to he has completed his graduation of hotel management and he's going to get recruited soon.
Exactly. So, Dr. Praveen, just what you just said
Not
now clearly
not just
tells me
not just
that.
not just one more thing I'd like to relate here, because I'm trying to give a energy. I'm trying to tell the people that this is something which you can always achieve, because I will tell you about the narrative of how genetics were told. I was told that yes, you have got first son, the second chances of second kid getting into autism is very high, to the tune of 70% or something like that. And
Oh,
to my surprise, in the sense, I spent some few restless nights uh, trying to work on autism, what to do if because my 7 years down the lane after my first kid diagnosed, we were having a second child. And during that pregnancy, I had everyone in my family was telling, what is the risk you are doing and all that. Then started telling, I did my homework a lot. And I said, okay, let me work on this. And I created a benchmark, in the sense I tried working on pre-pregnancy methods, what has to be worked out during pregnancy and post-pregnancy. We followed it diligently. And with that, my second son now has got admission into MBBS first year. He is into Vishakhapatnam Medical College. Why I want to tell you is there are some more than 45 or 50 parents who followed my advice. I gave them this paper. I said, okay, let us work on this particular thing. And I wanted to prove this thing that autism is genetic is wrong. It may be epigenetic things may be there, but if we are able to remove that factors and all of them have a healthy child, and it was somehow the when I see saw in Seattle and Colorado, the second kid, third kid also has been having that issues. It was really difficult. Now I am dealing with a case with from patients from Bihar. First kid has got, second kid also has got. So this is really, really kind of this one. And the narrative from the mainstream medicine is, no, this is not familiar. And how come? How come? You tell me. I have seen not just here, Dr. Preeti, I've seen in US also, achievers, the people who have gone to the biggest level of the
right.
IITs and all that, and their kids having autism, their kids having this learning disability and all that. What do you mean by telling that they have got genetic traits and all that? These people were way beyond. They are very good intellectuals, and they got their kids are autistic. Does it mean that they also had some autistic traits and all that? It was hard to digest, actually. And I tried to I have worked with more than 1,000 plus families with autism, and I am able to give them some good ideas and how most of them now they are doing well. But I can tell you, it is not familiar. The way the thing was, a thing called this all the kids are injured with the vaccine, MMR or multi pentavalent or some vaccines and all that. I can always prove that point. And so all the studies which were done, all the studies, they were done on the priority that this to prove it is not vaccine induced. They just wanted to prove that. So what is the next kind of thing to prove that it is genetic? There are some 200 genes are identified, but hardly it matters. We have so much about. You do functional medicine, you are into oncology also. You have BRCA genes, 9700 types are there, BRCA kind of thing. We can isolate only one or two. And if even if the BRCA gene is positive, we can make the person need to not getting into breast cancer by doing our functional medicine. So the same thing I'm just trying to work on this autism front.
Dr. Praveen, before I ask my next question, I definitely want to compliment you on the passion with which you have worked on this subject and the positivity your sentences are bringing around people, because I agree. I also see autism kids, and I've been able to get some very good results in those children. But in the beginning, it's so difficult when you tell the parent that do this and you will see the benefit. The parent says, no, my mainstream doctor has said there is no chance. Do behavioral therapy, and there is no need to change anything.
That's
Right?
a defeating process. That is the kind of thing, because I was told, okay, no, you don't do any experimentation with the kid because nothing is going to work. And when you start with that, because whatever cases we have done, Dr. Preeti, you are aware, we have done so many different cases, and the somehow, as a ardent student, as a big, I used to look into what is the cause of dilated cardiomyopathy. First point is idiopathic. What is the cause of thyroiditis? Idiopathic. Now we know
Idiopathy.
what is that idiopathic. This because they were not able to identify that. It is the mercury, it is the this kind of things which are, it is the pesticides, it is your glyphosate. So many things are now, but I believe doctors like us are going to have a bigger challenge, because there are so many elephants. It's not just one elephant in the room. There are so many elephants. We are not able to see. And I really sometimes I pity these people of people with the autism, because we are being guided by whatever the kind of somebody gives us the list of paper, the way it has happened in COVID. So why I should follow? I'll give a smallest example, doctor. When my second kid, when Mona was pregnant, and during pregnancy, it was told to go for a something like tetanus toxide vaccine. So my gynecologist, I was working in that hospital as a radiologist, very good hospital. You have got a operation theaters where super twin steel chambers. And I said, okay, I was a very always I used to pose difficult questions to this all my other group people. I said, what are the chance of tetanus neonatal? She says, no, no, it has to be taken. It's an age-old tradition without TT injection TT. I told, madam, do you know what is the amount of 25 micrograms of mercury is there in the TT injection TT? So she
Right.
says, so what? It is giving a protection. I said, okay, what are the chances of getting tetanus neonatal in your hospital? She says, my all thing is aseptic. We maintain very good thing. I said, then I don't want that. If my child is going to be born in a case where there is a Pakka hospital, very remotest place, he may need because tetanus. This is being directed 50 years back. That time there were no people used to give
Right.
birth in their home and all that, in that mitti and all. So that is a valid thing. You use tetanus toxide. Then so like that, there are so many things which have been followed since years. Nobody wants to question. We had questioned about injection DPT. I was telling injection DPT is banned in 1986 in US. You
Right.
must meet Barbara Lou Fisher. She's such an amazing lady. She wrote a book called "Who Shot in the Dark," and her kid was almost gone. She had convulsions and all that, almost death or in that kind of thing. It was a encephalopathy happened because of the DPT vaccine. There
DPT
is a
vaccine.
cellular pertussis combination. The pertussis was a cellular one. So after 1986, whole of USA, they stopped giving DPT. Instead, they gave DTAP, DTAP. AP is a acellular form of pertussis. With that,
Right.
you don't get something like convulsions and encephalopathy. And here the same thing continues and continues. We
And
have to it is really a difficult thing.
and
As a radiologist, Dr. Priti, as a radiologist, I used to go to that hospital. I used to work in a pediatric hospital. I used to visit the NICUs and all that. We used to do CT scans. We have done neurosonograms and all that, and we have seen people, children suffering from encephalopathy because of the DPT, and the word was being put across in the hospital that you are not going to talk anything about vaccine. I'm a very open guy. I had seen MRI, patient comes with the fits, MRI is normal, other things are normal, then the cause is only the CPT is causing that. 875, 1 in 875 is the association of convulsions in DPT injection. So what I mean to say is 1 in
which is
875 is
huge.
quite high, huge. And most of the patients who get this convulsions, they are put on lifelong therapy for these convulsions.
Exactly. So, Dr. Praveen, why I really like the area you are in and why, I really wanted to host you today is because it's not only the child's life, it is the parent's life too.
Whole thing goes upside down actually, topsy turvy.
Exactly.
Everything
When,
goes.
the birth of your child has added new energy in your house and you've just started enjoying that. And
Yeah,
some diagnosis like this comes.
yeah. It's a great. It is. We have seen a lot of families broken with that. It's not an easy
Right.
thing to have that.
Exactly.
Whole.
I've also
Yeah,
seen, and which is very surprising, the divorce is happening because one
yeah.
partner tells the other that it's because of you, blame game happens. And
Hey, Dr. Priti, I can tell you, I have been talking with these people. I try to take the info. I take the mother having a dental amalgam. I don't even tell them that this dental amalgam has caused you a problem, because immediately we can see the reactions among that. I don't even tell hypothyroid mothers have got the tendency to get into that, because what happens is that we are so, but now we are concerned, we have identified a subset of population who are having subclinical hypothyroidism. Also, they give rise birth to the kids who are susceptible to autism if we don't uh, do our homework properly. So it's a big challenge actually. All medical community should stand up. I'm sure all this. I'm really happy what a fantastic guy like Ashwini Garg is doing, because I used to think that array I'm only one talking about that. I'm really happy that Ashwini and all that we are on the same page, and we
yeah,
can
yeah.
really do
So,
some service to the society by
exactly.
trying to, yeah.
No, that's very important, Dr. Praveen. Dr. Praveen, before I go forward, I have a request to make. Will
Please.
it be possible for you to share that sheet so that I can attach this in the YouTube comment section? And people who already have one child with autism diagnostic
I'll do
can
that.
follow
I'll do
the
that.
same
Yes,
guidelines.
yes, yes. There are 3 pages only. Pre,
Perfect.
before pregnancy, you need to follow this. During pregnancy, and third, I'll give you that. Share that paper. I can
Perfect. So
concise it
I'll add
and
it
give it.
on the YouTube. So for all
You
the
should.
viewers, you will
You
have,
should. That
right.
is a kind of. It will be a great kind of contribution. It went Pune. There were a lot of parents from Pune, and this was before lockdown, 2018 or 2019. This was most of the parents used that paper actually.
Great.
It
Yeah,
went viral in Pune.
because when you have done it on so many, then I don't want to do it again. I will request your help to get it and do it. Uh,
Absolutely, and I'm really so happy. My second son, got into medicine. So I do. I want to tell you. I want to tell the world that okay, we are not autistic family or something like that, and it is not.
right. And in
It,
fact, yeah, and in fact, your elder son is also normal now.
he is
Right.
going to get a
Because you
job,
did
Dr.
all the
Priti.
right things.
Yeah, he's going to get a job in. He has completed his master. He has done his hotel management 4 years course. So God has
Wow.
been kind. God has been kind on me
Right.
actually.
But I think lot of parents, Dr. Praveen, try
They
to
should.
do something but are not able to. And you are very blessed that you did not leave where you saw that there is dark everywhere. You still found that ray of hope and went on moving.
No, it's all
And
because of people like you and who are my well wishers. I could do that. Only thing is, I was only a kind of I do one thing at a time. But autism, it took me nearly 10, 15 years. I did my MBBS for 5 years. I did my radiology for 3 years. But autism took me 8, 10 years. It's not an easy track actually.
no, functional medicine overall is not easy because it goes into the roots of your thing and it actually helps you change your genes also.
Yeah, what I'm looking nowadays is people. I was telling one doctor today, psoriasis patient, it's easy to change religion than change the diet. Actually,
Right. But
diet
diet is
is
so
so difficult.
critical because it's a
Oh, so difficult.
messenger. Right.
Yeah,
No
yeah.
more only calories.
I can tell you, I told my wife, ki, no, this looks like he was 5 years old that time. I said there must be something with the diet. We should stop taking wheat and milk. I'm convinced. I don't want to get convinced anywhere. Then she started weeping. She says, "Arey, what milk and wheat only he takes? He takes only bread or milk. There is no other thing." So I can understand the
So,
kids
Dr.
which
Praveen,
yeah,
I work a lot with gut health patients and I make them do elimination diet.
yes,
So, I think almost 1,000 plus people have done elimination diet under my guidance in the last 1.5 years.
perfect.
And what I've seen is if somebody comes and tells you, can I keep eating this? Rest all I can avoid. You already know that person is allergic to that. And there is science behind that, which you must
नहीं
know, is
नहीं नहीं
that it activates the opioid triggers.
exactly.
And what cocaine does to your body, the food
Weed
with
can do
which
that.
you are allergic to does the same thing.
Exactly. All these
Yeah, so
electronics
now
also.
I'm working with some celiacs.
Okay.
And for them, leaving gluten is so difficult in the beginning because they start getting Herx reaction.
Yes.
So you have to make them first decrease it by 20%, then 40%, then 80%, and gradually, help them wean it off.
I can tell you, it has helped so much. Autism has helped so much for my practice. See, I try to any nasty case also. I tell them, okay, you stop taking gluten, you stop taking this particular stuff, and it helps a lot. Why do I do? I sometimes pity this other so-called super specialists. They are not aware about this or what. They keep doing scopies and scopies and scopies, and nothing comes. That's a kind of
Dr. Praveen, the moment you are off this life, your phone is going to be ringing a lot.
come on. Always, I'm ready to face the consequences, but I somehow believe that if
I
there is an
agree.
elephant in the room, you should see it. It is a
I
illogical thing. Yeah.
I agree, Dr. Praveen. We have few questions. I'll take those and then I will continue on. What is it that you advise, for autism and what is your approach to autism? But before that, I'll take this question. What is your advice to parents whose children are autistic?
The thing is, it's a. I can always tell you, you people are number one blessed. Take it this way, and God has chosen you because you are capable of carrying these kids. And I can
Yes.
always tell you that involving with autism, it will make you more responsible human beings. You'll understand what is the kind of take some breaks sometimes, and you need not be totally overwhelmed with the subject and all that. Try to follow a simple any. I tell everyone to go to even in US anywhere, go to an integrative or functional medicine doctor. He will take care of you. And I can always tell you, don't get overwhelmed with the knowledge, what is being circulated in the WhatsApp and all that. Because if, for a person like me, who was always, I used to love my books only. And it took me so many years to understand what is autism. For a non medical person, it's not easy to understand everything at one go. And there is no ready made khichdi here. No treatment is something like, it is not like anti-tuberculosis treatment. Anti-ATT, we gave a combination of four. Chalo bhai, lelo, you do whatever you like after that for 9 months. It is not like this. It has to be dealt with personal doctor. It's a personalized medicine. At the same time, I encourage people, particularly mothers and parents, not fathers and mothers, try to not go by the way the society treats you, because I have seen my people only telling, "Are ye to pagal hai." So the thing is, your blood boils, and you will be demotivated. And try meeting very people who are positive only. Don't get into that skepticism. Are what is this? Don't try to move a lot. Don't stop that place. Are my kid is there. Let me no, don't go to the parties and all that. Wherever we have gone, we have taken our kid along with that. If the society doesn't accept, it is their fault. Let them come into terms with that. And yes, you put your conditions and all that. Yes, it is. I think parenting autism is something you are. I think you are. Maybe it's a easy thing, but you at the. I have seen a lot of patients who got their health got better just by cutting that stupid wheat. That
Exactly.
stupid, yeah.
Exactly. And
Parents
anything
also
more
they
you
started
can do
doing.
is positive.
Yes,
Anything more you can do
yes.
is positive.
I have
Dr.
not taken
Praveen,
sugar for the last 25 years. I don't take sugar in my tea also. And if someone gives me a cup of tea with sugar and all that,
I feel
I
like
find it very nasty.
vomiting. No, I
Yeah.
feel like vomiting after that. If
Yes.
sometimes, I'm
Yes.
not able to say no,
Yeah.
right? And
Yeah.
Dr. Praveen, I am a typical Punjabi who used to love her tea and coffee with two spoons of sugar instead of one.
I have given up 25 years back. I read something about sugar, nasty ways of sugar. Where when I was reading all this, I said, okay, I'm not going to. Then the counter question is, my sister tells, अरे तेरे को अभी diabetes आया नहीं, अभी से क्यों कर रहा है तू? मैं बोला, I don't want to wait till diabetes comes.
Right.
That kind of.
Now, Dr. Praveen, exactly what was in my mind, you've triggered that. A lot of
Correct.
clients who come to me when you tell them about functional medicine and what all they want, they will have to do, especially changing diet, which is very difficult. They prefer to go to Ayurveda, to homeopathy, stick to allopathy, but they don't come back to you or any other FM doctor. What is
नहीं,
your viewpoint on this, and will you want to suggest something to these to
नहीं,
these parents?
the thing is, as a clinician, you always have a big egos actually. If someone comes to me after so many things, I feel that okay, I'm the best doctor, and I try to take up things in a this one. I suggest every parent or something like that. The person who talks about okay, हम ठीक कर देंगे, we'll do आपको जो खाना है खा लो. What happens here is that he may be doing in a good intention, but the repercussions are going to happen later. You have to most of the homeopathy, Ayurvedic, they are good, but when we are talking about something like autism, which is a multi-system disorder, and it was not dealt by anyone before, this has come only after 1942. There were no cases of autism reported. Now there is a kind of epidemic. So if we don't know this, let us try to figure out in a collective way. I use sometimes homeopathy also for my patients, but I tell them, okay, you don't compromise on your microbiome, don't compromise on your detoxing skills. That's a very essential part. You have to have that. Parents are always. I have seen a lot of parents. They want to go for the quick fix, and
Exactly.
yeah, there is a quick fix. They say, "Okay, we'll do within 21 days." If somebody is able to do that within 21 days, it's very good. Only thing is, till now, you have to. There are no shortcuts for treating autism. It requires minimum of 6 months to 1 year, and it is a hard work, and not just by the doctor. It has to be with the born by the parents also, and even the family also suffers. I have seen. I have got a patient right now, and the child, his sister also, elder sister, she doesn't touch any sweet, she doesn't touch any coke. The whole family doesn't keep anything inside their fridge. So it is in fact, it is a good thing for all the family. But you should be, you have to be ready with this one. You quick fixes. Normally, you get then
Don't
the
help.
repercussions will be problematic later.
Will be a problem. Also, Dr. Praveen, I'm seeing that when people are trying Ayurveda these days, lead is increasing in their system. Do you have any opinion on that?
100%. It is actually what happened was when I was in US, or Ayurvedic Chyawanprash was brought into a much disrepute, and I have seen my father's elder brother, Bade Papa. He used to take Chyawanprash like this, and I can always correlate that later because I had treated him for peripheral vascular disease. There was a huge calcifications of the all arteries and all that. he used to go for one amputation of one finger to another finger. And now, retrospectively, I think because of the chain crush and all that lead, he got that peripheral vascular disease. I can always tell you one thing: the Ayurveda has got good concepts, but in this era of money making or whatever is it, you cannot have that chain crush bottle being 200 rupees. If you get a pure Chenpash, it should be very costly ones. If you want to sell within that 200 rupees, you have to add literally lead into that. That's the reason we all in US we got a disrepute. Ayurvedic, even our rice, Indian rice, people are scared to take because it was shown to have arsenic and cadmium in that.
Exactly. And Dr. Praveen, I use oligoscan for testing heavy metals, and there is hardly a client who comes and does not have excess heavy metal these days.
Oligoscan is such a beautiful thing, Dr. Priti. Even I will test. I will be having high levels of mercury. I'm sure about that. Right, but
I
yes,
I agree.
we all of us have got. Only thing is
And we
we are
need
able
to
to
work on
excrete
it.
it. Yeah, we are able to
Exactly.
excrete it. We are not getting into
Right.
something like Alzheimer's and all that.
Yesterday, I saw an aunt who is suffering from Alzheimer's and reading in books and seeing somebody. It's so different. That any day we can do something early on is really the need of the day today.
No, I think we are going to get increased in numbers of Alzheimer's post this COVID jabs and all that, and we have to be ready with this. All functional
Right.
medicine doctors
So
get
there's
prepared
another
for those odds.
question. Yeah, Dr. Praveen, there is another question here. Is there a detox you can suggest for parents to help detoxify the body from vaccine related toxins?
Exactly. Vaccine-related toxins are usually aluminum, mercury, and we are working on usually these two particular stuffs. And parents should work it out. Try to use a lot of chlorella and whatever is available, kind of which foods which are available. Try to use that. I suggest very simple things for. But when we are dealing with autism, we have to be more careful about. Because there is a we cannot afford to do a steering business there. We What happens with that if properly detox is not done, there is going to be a redistribution. It comes out from one place and it gets into the other system, which is not a ideal situation. And that is where this all this chelation and all that has come into. If it is not done properly, it is we get a lot of reactions and all that. You may get a long term kidney problems and all. So we need to look at 10 years down the lane. Immediately answers are not very this one. Yes, detox is one thing which I believe has to be a integral part of any autism treatment. What I mean to say is, I'll give a small example. Ki, detox is like if your car is, you have got a crash, in the sense you have a dent on the car, you need to do a denting and you need to do painting also. You need to do both the things. You just can't. Similarly, we work on. It is an
Very
integral
beautiful
part.
example, Dr. Praveen. Generally, what we do the denting when it comes to our body's detox, and we don't do the painting. So the detoxificant is already creating havoc in another place within our body only.
Other place. You need to remove that soft tissues also. That's the most important thing. Yeah.
Great. So I hope Arvind got his answer. Dr. Praveen, what is your protocol for autism children?
Autism children, basically, I am working on some things like started clean the environment. Number one. Now I tell clean the environment. The most important thing what I tell is it's a kind of major thing. The people who are coming to us, they are not ready to switch off their Wi-Fi. I say you need to switch off the Wi-Fi, and they should not use something like fluorescent lights in their home, right? Another thing is try to keep away all the cleansers and all that, air fresheners and all, and you are not using your any kind of uh, fragrances and all that. You It has to be fragrances free. Mother and father both has to uh, kind of, they need to work on that. This is clean the environment. Then we tell that not to use any much of electrical gadgets across the bed of the children, and even the bed should be we I suggest cotton beds for everyone, not the foam
Yes.
beds. There is a thing called PVDs which keep on causing a problem, and other stuff is when you whitewash your walls, you see that your walls basically are lead free and this cadmium free. Most of the now you need to pay some price for that, but you'll get that.
But it's available.
It's available now. It was not available, and people are not aware before about that. That are the things, and we tell about trying to work on the hygiene part a lot. Hygiene part is trying not to use the children diapers and all that, because that you should always try to switch on to the people try to use this. All dioxins are there in in diapers, which can cause problems. And I can go on and on. Only thing is, yes, I'm not very happy looking at the products what is being sold across. So I believe that it has to be in a proper way, or right. You start from your bedroom, come back to the kitchen later. In the kitchen, no pressure cookers, and try to see that you don't use this microwave oven. Microwave oven is a big no-no.
Big,
It's like
big
having a sun
nuisance.
tower. Yeah, even cell phones, whatever you are doing, try to see that they are not always in a on mode. Try to remove Bluetooth from that. Try to remove the all this Wi-Fi and use the phone like that. I had seen somehow it is a somehow I can always I need to connect with people who doesn't understand that the child who is he is greeted, a newborn child is greeted with a cell phone here, and he is being given cell phone and said, "Arey Nana go suno, Nana is in something Delhi," and the he cries at the. So this is something which is very very ridiculous, and the child should not be given a cell phone. I was telling the other day, maybe I was telling some other doctor also. I have a one I mean, in my house in front of with 3 BHK. Other one child is there, and the parents are so happy. 1 year child, Doctor Saab, our kid is, "अरे वो पूरा YouTube पूरा चला लेता है." I was really shocked. I said, "Arey, why do you want to give him this particular stuff? The things are not good. This kind of screen time, 50 years later or 40 years later, he's going to get into Alzheimer's if he starts using cell phone like this now. So it is better the child gets a small. I think we parents also, they are not aware. I think they are not aware about. They feel that it is a big this one,
Also,
and
Dr. Praveen, the advertising industry and the way we are working. For example, to do this YouTube live, both of us are sitting in the Wi-Fi zone. And unless, we are really aware, we won't switch it off immediately. So making that balance is not easy in the current environment also, I think. Dr. Praveen? Hi, viewers. I think in this very interesting conversation, Dr. Praveen's Wi Fi is having some problem, but we will have him back soon. Just wait for a minute. Till then, if you have any questions, please post. I have loved this conversation with Dr. Praveen, and I'm sure you would also have loved it. Learned a lot from it. And if you have anybody, who you think can benefit from this, please share it with them so that we can help autism children live a normal life. We all know during COVID times, autism incidence has increased, autoimmunity has increased, and it has become all the more important that we become aware of how to manage this condition. Just give me a minute. I will just see what is happening. Let's wait for 2 more minutes. So Arvind, yes, in autism, I have, at least in my practice, seen dysbiosis contributes a lot. There is science to show that there is gut dysbiosis in autistic children, and once corrected, it really helps in getting the child back, and we see a lot of improvement in his symptoms, his or her symptoms.
The number you're calling is currently switched off.
So I think his number is also switched off. Something has... So friends, I think there is some issue, network issue at Dr. Praveen's side. So till we wait, I would want to add few more things about management of autism when it comes to functional medicine approach. Infrared saunas, red line therapy do help in these cases. A lot of these children are seen to be dehydrated. So correct way of drinking water, especially if you can include sun-charged water in your life, it can really help. We all know this Mosito study which says that water has energy and the crystals are formed in the shape and way, the energy which we give to this water. Sun-charged water is very, very positive for our and our children's health. So if you can take a glass bottle, take 1 liter glass bottle, fill it with water, keep it in sunlight for 4 hours, say from 6 a.m. to 10 a.m. or 7 a.m. to 11 a.m. and then bring it inside, and that's the water you drink. This alone will help you feel better. And sorry guys, I think something major has happened because Dr. Praveen is not able to join back. I hope you enjoyed whatever we spoke, and I will have him back once again to talk about what he does in his practice for autism children, because I for sure know that he uses chelation to take out heavy metals, which he was talking about, and he has seen promising results doing all of that. Thank you. All the best. Stay healthy, stay happy, and it was nice to have you with us.